Thanks to Mina Merham and George, they really did leaps in what we failed to do in the older group. Before I start, I just want to learn a little bit about you. How many PTs are here? Physical therapists or doctors of physical therapy? Okay. How many pharmacy or pharmacy students? Okay. How many PAs or physician assistant students? 2. 3. And how many medical students? Okay, and of those medical students, how many of you are about to choose your residency or choose your future? Okay. And I'm coming to that. For those, don't feel bad. For those who are choosing, I think Semana need to do something also for people who are still not able to decide on their future program or residency. I think it's a good opportunity you talk to Hani Alian, George, Michael, myself, Ayman Skandar tomorrow. At least ask us what is in your mind. Don't be like in the dark completely choosing your residency unless you completely know what you want to do. With that said, how many dental students or dentists? Beautiful, beautiful. Nursing or nursing students? Optometry. So one, very nice. I don't see well, so that's like, okay. So this is the verse that Mina chose for the retreat. And we want to make sure that we repeat it a couple of times so we don't forget. He has shown you what is good, and it was an amazing lecture of what is good and the relativity of what we are living in today. And what does the Lord require of you to love mercy and to walk humbly with your God? And I'm trying to introduce a topic or the topics that Abuna will be coming in to speak about, which is what does God require of you? And I chose this topic, which it's more than one lecture, but for this retreat, regardless if you are a pharmacist or a PA or a dentist or a doctor, if I say doctor, please do not feel I'm not including any one of you. So the spiritual doctor. By the way, our Lord has so many specialties. So if you're choosing dermatology, he have healed leprosy, which up till today is a major mystery how to heal. If you are a PT or choosing neurology, Dr. Heidi is here. He have healed so many paralyzed and seizure activity. Pediatrics, he resurrected Tabitha. If you are a GYN or planning to do GYN, he didn't really deliver babies, but he created them. But for GYN, the woman who had 12 years of bleeding, we think it was a GYN bleeding. The ENT, he healed the deaf and mute. And for orthopedics, spine surgeons, physical therapists, there was a woman who was bent for 18 years and he healed her. Where am I now? The emergency department, I know she's sitting back there. Wound care, ED, Good Samaritan. For oncologists, the bleeding woman, some of us think that she may have cancer and she was bleeding for some years. We're not quite sure. Psychiatry, he was a professor of psychiatry dealing with a major depression in the Samaritan woman. And finally, although it's not well documented, but he really, the first one who gave general anesthesia to do thoracic surgery on Adam.
Brain surgery.
No, I mean, plastic surgery, by the way, Malchus lost his ear and he was able to, and there was no scar seen, so if you're choosing any specialty, by the way, I couldn't find pharmacy, so don't feel bad. Okay, infectious disease. Peter's mom, she had a fever, which we read in the Vespers hour. Ophthalmology more than once, and you can include yourself with that. He really healed the blind without needing any corrective lenses. With that, the spiritual doctor could be passionate, prayerful, faithful, and content. But for this retreat, the one who you want to count on to be reliable, trustworthy, dependable, faithful, we need to talk about faithfulness. And in our healthcare system, I can tell you, this is probably the worst worm, sin, evil affecting all healthcare. To become less faithful or faithless or no caring for the person in front of you. If we were entrusted, and out of all specialties and out of all jobs out there, we are the only ones who actually can help correcting a creation of God to go back to His perfection. That's what we do. If we lose the faithfulness, we should not be in this career at all. So, most men will proclaim each his own goodness, but who can find the faithful man? That's Solomon said that. Who can find a faithful doctor? So why should we be faithful? Number one, because God is faithful. He said, for the word of the Lord is right, and all His work is truth. Why should we be faithful? Because faithfulness makes patients trust us more. And I can tell you, if I can, as an older physician than most of the people, all the people in this room, if I can just be able to tell everybody, please be faithful to your patients, then I have done my work. Because I can tell you, the confidence that you will have from the patients and the families are priceless. And if you cheat them or mistreat them by lack of faithfulness, then you ought not to be in that career again. So it's so important, and I hope you give me your attention as much as possible. Confidence is an unfaithful man, and time of trouble is like a bad tooth or a foot out of joint. Look how much Solomon almost depicts unfaithfulness like something is out of place, like somebody has a dislocated ankle or a tooth that's causing problem. Why should we be faithful? Because I'm sort of paraphrasing here. God rewards the faithful healthcare givers. Again, I'm biased here, but the verse is not too foreign. His Lord said to him, well done, good and faithful servant, good and faithful doctor. You were faithful over few things. Talking to a patient, taking care of a family, stitching a wound, making a cardiac cath, doing a delivery of a baby, correcting eyeglasses, whatever you are going to do. Over few things, I will make you a ruler over many things. Enter into the joy of the Lord. I don't think our Lord will be upset if we exchange the word servants with doctors or any of the specialties are here. So for the next 20 minutes, I want to cover these 8 points. Which aspects you need to be faithful at, or how to become faithful. Number one, and I'm going to discuss them, but to enumerate them, keep your promises, honor your marriage, use your talents, make the most of your time, stand by your friends, manage your money, do your best at work, and commit to the church. Number one, keep your promises. Whoever falsely boasts of giving is like clouds and wind without rain. You know what it means, this verse? That you promised everything. You promised blessings. You promised the rain is coming. You promised you are going to stand by your patient. You promised everything. And you were absent. You were completely out of the picture. You were not seen afterwards. Keep your promises to your patients and their families. Promises like, I'll be there, this type of treatment will do this, the price will cost you this. Be faithful. Some of these things may be a little bit too foreign for you. You are second year medicine or third year or around that time. It may not mean anything. And you think, of course I'll be very faithful. But I have been in this business for over 20 years, and I have seen a lot of unfaithfulness. And a lot of it do not come from a poor doctor. Because every single one in this room, in a couple of years, will have $100,000 out per year and maybe much, much more. So God will bless you. But can you imagine, in spite of people getting 6 figures, a lot of them promise and do not deliver. And that's why you think about it, but God actually gave you a major, major responsibility. You are not building a house. You are not fixing an electric plug. You are not exactly connecting a plumbing problem. You are entrusted with a life. So keep your promises. Better not to vow than to vow and not pay. Let your words be yes, yes, and no, no. So, have you ever told your patient, of course I'm talking about the future, were you going to ever tell your patient, I'll be right back, and you never came back? It's very common. Very common. You know why? Because, you know, I got my visit, it's 15 minutes follow-up, Medicaid pays me $9, why should I spend another half hour? Some of the numbers I said are very true, by the way. But can you imagine what's happening here? What happens here, I'm equating what I get to a responsibility of a creation that I know to fix because I'm working hand in hand with the Creator. That's your job. I'll be right back. You never came back. You promised you would pray for someone and you never did. That applies to every single one. It's a patient, it's a family, or it's even a friend. Are you faithful in even, I know of a girl, many years ago I met her. She was in ECCOIC. I know from which state now, but I remember very well. When she had, I'm not sure if she meant or not, but anyone will ask her, can you please pray for me? She has a little paper, and after she leaves the person, she writes the name. And I told her, what are you doing? She said, oh, I'm keeping a tab of the people who I'm going to pray for at night. Again, I don't want to, excuse me, give me your name, and I don't mean it this way. But I'm saying the degree of faithfulness versus the degree of sloppiness or laxity or whatever you call it. Promise to help a needy and you didn't. I submit to you, you guys are going to be the most humane jobs around. If somebody in their most needy situation and you offered or you promised or you could, but you know what, it's not going to add to my bank statement, it's not going to give me a prestige, it's going to, and you let go, you are being dropped from the high ranking working with the Creator. Promise to be, sorry for the spelling, with the patient in the worst times and you didn't. I remember very well. This is a guy who just died under my watch in the hospital. This is most of you may not know what I'm going to say, but I'll say it for the few who may know. 36 years old, he had a rhabdomyosarcoma, and he's an adult. And rhabdomyosarcoma is a sort of a child tumor. It's a very bad cancer, comes in the paranasal sinuses going to the brain. The guy lived about 2-3 years, but the cancer came with vengeance. But there is one thing he asked of me. I know I'm dying, but can you be with me when I'm going to die? And he had his girlfriend, he has his mom, and there was something called terminal extubation because there's nothing can be done. And I have his picture with me because we took a picture together before that when he told me, I need you to be with me. Thank God I was able to be with him. I'm not saying, but I'm sure I didn't do that with many others. But I can tell you, I want to be more faithful for anyone who tells me, be with me in the time of need. Be with me in my worst time. Can you be with my mother when the doctor tell her that my son is so-and-so, or the baby is being born defective? Can you be with my husband? Are you going to be with the husband? Or you don't, you deliver the baby who is defective, and, there is a lot of doctors will not do that part. But if you want to distinguish yourself as a spiritual Christian doctor, this is a task. There is a lot. A physical therapy will, crack some things and correct some joints and do some spines. And there is a lot of psychological things happening with this guy or this girl who is so uninterested in her image because the way she looks or the way she walks. Are you going to be with the person and her needs? Second, not that most of you are not married, but when you get married, a lot of doctors, because they have a lot of money, they have a lot of relations, they claim they have a lot of stresses, they are surrounded by nurses and therapists and technicians and whatever. And you guys, whoever rotated, know what goes on. What goes on in the wards, what goes on in the on-calls, what goes on. But you know what I mean? Are you going to be faithful or not? You want to promise from today, faithfulness. Promise upon your blood. Yeah, I mean, nothing will happen like that. I'm not going to do this. Even, I will never forget what Pope Shenouda said in one of his poems when he said, I will obey God even if I obey God alone. سأطيع الله حتى لو أطعت الله وحدي. I will obey God even if I'm the only one obeying. And you will find yourself sort the nerdy doctor, not because of your scientific explosions, but rather you're quote unquote you are not going with the rest because you are more faithful. But I want you to be that unique, because you are being rewarded for your faithfulness in many other ways. Number 3, use your talent, guys. Medicine and all its paramedical specialties is a talent. Is a talent. You guys are going to have in your hands and your mind and your heart a talent. Do not make it just a job. Because if you make it just a job and all what you do, you just get a couple of money and whatever, fine. You will be very happy, comfortable in all of this. But you are not fulfilling the faithful spiritual doctor that God rewarded you to be. There is a lot of people who want to be in healthcare and they couldn't, they didn't, they can't, whatever the reason. You were blessed to be in one of the best paying jobs, most prestigious as respected jobs, but there is a responsibility with it. Use the talent. I just heard something about pharmacists, very interesting, from a priest in Long Island. Oh, I love him very much. He told me some pharmacists in New Jersey agree among themselves to pray on the medicine, on the bottles, before they give it to patients. I'm just giving you examples. There is no end to examples of faithful spiritual physician or caregiver. But one of them, as each one of you has received the gift, ministers to one another as good stewards in the manifold grace of God. Faithfulness does not depend on what I don't have or can do, but faithfulness depends on what I can do with what I have. So even if you have little money, little time, or you have little knowledge, just be faithful with what you got. You know, I like very much when a young resident, second year, first year, comes and say, teach me this. I want to be good at this. And you know, knowing this or not knowing this will not make a difference in her final money making. But this honesty is a talent. And you want to be talented. You want to be faithful in your talent. Because that's a talent. You may be an artist, maybe a musician, you may be a singer, fine. But the real talent is becoming a good, spiritual, kind doctor. So being a doctor is one of your major talents. Use it and make others benefit from it, not just boast with it. It's very easy that it's very easy for all of us to feel very accomplished. Very easy, which is fine. But if it stops here, we are missing a major point. It's as if you have a lot of money in the bank, but you forgot the PIN code, the password. You are just rich without having anything. Don't make all what you are accomplishing. It's just an element of boasting, and that's it. Number 4, make the most of your time. See, St. Paul said in Ephesians 5, see then that you walk circumspectly, not as fools, but as wise. There are 3 things can be done with time. You can spend it, you can waste it, and you can also invest it. And there is, as a physician, as a pharmacist, as a dentist, as a wherever you are, your time will be limited at one time, and many times. The amount of time you can use is going to be counted for you or against you. If you want to be, again, faithful on the talent you were given. What are you doing with the time? So, there are things that you can waste time on, like regretting, I should have been an obstetrician. And you have done already 4 years of emergency medicine. Come on, move on. Move on, keep going. Keep going. But what are you going to do? You're going to do 2 residencies? Why? Keep going. I have seen people in my life, they spend so much time on looking at the past than looking at the forward, and at the end we waste time and we don't know where we're going. Don't waste time. Don't keep looking backward. Worrying too much about the Medicare cuts. This is a word Heidi, myself, George, Hanny will know these things, but every now and then there's something called governmental cuts, and fine. I know doctors every single time. We go to get a coffee from the doctor's lounge, everybody's talking about Medicare cuts. As if they don't have enough money and this whatever percent is going to make them the poorest of the poor. I mean, nothing like that, but okay, fine, what can I do? I mean, can you do anything about it? Probably nothing, except do something wrong. But if you are not planning to do something wrong, then you know, why are you worrying about the future? God have given you so much blessings. Don't worry about it. Over concerned about the details when the overall picture should have been more concerning. Like, you know, the doctors are usually perfectionists. They are type A personality, most of us. Very minute details and looking at why this is crooked, and the overall picture is missing, is crooked. We are spending so much effort and time in minor details, and we are not fixing the bigger picture. So reconsider what's your schedule. There are a lot of times doctors have things, or physicians or health caregivers can actually reduce some of the things they don't have to do. This is actually one of my most important points. Stand by your patients. I don't care if you are a pharmacist, if you are a dentist, if you are a PT, if you are a PA, if you are an MD, if you are DO, regardless. Stand by your patients. I cannot emphasize how much every time I say thank you, God, that you made me what I am, because I can't imagine myself all what I do is painting walls or fixing pipes, or I'm happy that I'm fixing people. It's a major blessing. You guys should thank God about it every single day, all the days of your life. So you cannot, you should not decline standing up, standing by your patients. Your patient needs you to stand by him, inquire about his needs, his hopes. Your patient wants you to oversee his or her life, not just to fix a little thing. That's what they call it today, holistic medicine. Holistic medicine is not just looking at, I'm ENT, I look at his nose. There is nothing else next to the nose. He is just a nose for me. But there are a lot of things happening behind the scenes. I know time is an issue. Believe me, I know all of that. But I'm trying to teach you what I have learned after a while. And I'm hoping you stand by what I'm trying to tell you today all your life, because it will give you so much joy. Not just joy of success that you are a good doctor, but you are a spiritual doctor. You are an amazingly kind doctor. So, a friend loves at all times, and a brother is born for adversity. I just want to show you a couple of studies about this. This study is published in the Journal of Health Psychology. And religious struggles are predictive of mortality. I don't think anyone would have thought that this is actually a scientific literature. Some patients are involved in religious struggle that may have deleterious effects upon their health outcome. This was published in 2001. However, in 2004, another study was published, and the research here identifies forms of religious struggle that are predictive of mortality. Those are patients feeling alienated from God, unloved by God, punished by God, or attribute their illness to the work of the devil. They have mortality rate up to 28% compared to those who do not have these issues. What does this make you? A preventer of unneeded mortality. If you tell people, I'm by you, God is with you, and of course that's a different topic. I'm preparing a whole topic to myself more than to anybody. The spirituality and medicine, and how can I be a doctor who can pray with my patients. And I'll come to that in a second. As George have mentioned, this study also published in 2013 in the Journal of Healthcare Chaplaincy. Up to 77% of patients would like to have their spiritual issues discussed as part of medical care. Can you imagine this? Can you imagine that 3/4 of your patients wants their religious factors to be brought up? Less than 20%, however, of physicians currently discuss these issues. Clearly, physicians are not inquiring about, this is the quote from, so this study is very interesting, published in 1991. And basically, they surveyed physicians and patients in the Journal of Family Practice. And they looked at 3 questions. Ask me about my religious beliefs, stay silent, say a silent prayer for me, or pray with me. And they did that in 3 conditions: office visit, hospital inpatient admission, or dying. And look at these things. Look at even dying. Ask me about religious beliefs, 70%. Say a silent prayer, 55%. Pray with me, 50%. In the office is a little less because there isn't yet a rapport between the patient and his doctor. But look at the numbers, staggering. Staggering. Because what it tells us that the world needs more Christian spiritual doctors. So I could give this talk anywhere, by the way. It doesn't have to be Christian. I could actually speak to Jewish doctors and tell them you need to be kind and spiritual with your doctors, with your patients. They need it. 77% they want. They want attention to the spiritual details. I recently finished this book, by the way. I'm not here advertising about it, but it's a very interesting book. It's called Gray Matter, written by Dr. David Levy. Look at the top. You can't read it here, but I'll read it here. A neurosurgeon discovers the power of prayer one patient at a time. And let me tell you just the story in half a minute. He is an endovascular neurosurgeon. And just in case if you don't know what it is, because it's very small specialty. Not just he did 5 years of neurosurgery, he did 3 years of what they call endovascular neurosurgery, which the aneurysms of the brain, the arteriovenous malformation of the brain. It's a very, very sophisticated job. And very few people, and this guy is in San Diego. I hear some of you from San Diego. And this neurosurgeon decided that he must pray with his patients. And the struggle he went in, both internally and among his colleagues, were not easy. But he prevailed. And amazingly, his patients loved it. The nurses sometimes tell him, call us when you are praying for any patients. And his colleagues eventually did not mind. They don't care to pray with him, because I told you the number of physicians praying are less. But physicians will tell him, yes, we would love you to pray for us. But the book states how much struggle for each one. And that's what I'm studying these days. But I can tell you, since I read this book, I'm more courageous now to ask patients, would you like me to pray with you? And if they say yes, fine. Still now, I yet to find one patient to tell me no. So you have a responsibility, and you cannot decline it. If you choose this job does not only come with the money and prestige. It comes with an equal responsibility, faithfulness. Responsible faithfulness. Number 6, you need to be faithful about money. I told you you will have plenty of that one day, very soon. Okay? But believe me, life is not just about this. You will eat the same, you will live the same, your heart rate will be the same. Okay? However, if you are not faithful about money, then you have a problem, because you are a steward. Therefore, if you have not been faithful in the unrighteous mammon, who will commit you to trust the creation that you need to fix? I know of a guy, this is a true story, and unfortunately he was Coptic, but that's many years ago. He's still around. This guy was a pulmonologist, and he had some affairs outside marriage, doctor. Eventually he was imprisoned because of a claim that he tried to kill his wife. Whether this is true or not, I don't know. Came out of prison after 12 years. I met him after that. He lost everything, of course. License, wife, kids, everything. He used to tell me, I used to leave on cold nights, especially in the Jewish holidays, to cover so many, with about 6,000 cash dollars in my pocket. That's outside what he gets, just one day. I'm trying to tell you, okay, fine. You have all this money, but everything is gone. Gone, gone, gone. Please, please, I don't want you to be so fixated on how much money this job, and should I take this or this. Think also, if this job will take you away from the church and the godly things, and they do crooked things, and your partners are doing strange, or you take you away from your wife and kids, or there is a nurse there that, it's not going to be comfortable for you to, all of these are factors. It's not just the amount, the zeros. On the first day of the week, let each one of you lay something aside, storing up as he may prosper, that there be no collections when I come. He was talking about the poor in Jerusalem. How can you be faithful giver? One of them is donate regularly. By the way, a lot of us are planning to donate when we get a lot of money after the first job. Rest assured, if you do not know how to donate when you are poor, you will be more greedy when you are rich. By the way, the number of greedy doctors who do not donate are much more than the poor who gets $30,000 a year and they donate sometimes more than doctors. You know why? Because the love of money is not equivalent to how much you get. I want more. Second, plan a tithe account. I'm teaching my boys and girls here, sons and daughters. Plan it. This is not something you are going to touch. Consider the poor patient. Consider. You can give $20 to this guy who needs a cab to go home, and ambulette or whatever did not wait for him. Nobody can see that. Nobody has to know this. But you are a spiritual doctor. This is another talent. How do you use it? The money. Make part of your business for charity. Longing to be rich may take the time and integrity from other things. Okay, number 7. We want you to be very scientific, publishing, top of your careers, known, excellent at your work. Do the best at your work. We don't want mediocre doctors. We don't want anything. We want the best. We want like Joseph. We want people who are really known, and people come and say he is good because he is very faithful. Then your Father in heaven is being glorified. That's how we glorify God. You don't have to put a big, huge icon of Saint Mary in your office to claim your Christianity. But if the humility and meekness of Saint Mary appear through your work, then you have shown her icon. You know what? This is what we are preaching as a doctor. Remember, those patients you are going to meet come sometimes in the most vulnerable times of their lives. Most vulnerable. Most vulnerable. Some of them are about to lose a spouse. Some of them, the children are abandoning them because of whatever sickness happened. And you are the only one. So, do your best with these people. He who is faithful in what is least is faithful also as much, and he who is unjust is also unjust in much. Be faithful in, yes. I'm saying this with a lot of, remember, I'm trying to be very wise in what I'm choosing my words. In a lot of specialties, you're allowed to know secrets. You are allowed to see things that you're supposed to be careful with your eyes. You need to be faithful in what you say, in what you hear, and what you touch. You see what I mean? I know of an anesthesiologist, unfortunately, and I believe he lost his license also. A lot of doctors I know lost their license. But this guy wasn't Coptic. He was in California. No, that doesn't mean anything. But I mean, he was fondling patients under anesthesia. And the nurse complained. Again, it's not because the nurse complained or he lost his license or that's not the point. Again, it's a responsibility. You are given the creation of the Creator to fix. And you need to be faithful on what you see, what you hear, what you touch. A lot of secrets will be given to you. That's not for sale and not for distribution. So be faithful in your looks, your touches, your thoughts. And if you have not been faithful in what is another's man's, who will give you what's yours? What's yours is kingdom of God. If you were not faithful in another's, how can God give you what's yours? Put your heart in your work, and whatever you do, do it heartily to the Lord and not to men. Finally, commit yourself to the church. I can tell you a lot of doctors who were deacons are hardly coming to church after they graduate residency. and become wealthy and they have more than one car. You know why? It's not becoming more busy, by the way. I'm not sure if it's true or not, but I think we think sometimes we have less need of God when we become what we become. Please, guys, do not ever think that you have succeeded and achieved what you are about to achieve in your life alone. So commit, meaning I'm not going ever to lose my service in the church. I'm going to commit to liturgy at least twice a month because I may have other things to do or work or whatever. Not that it's I mean, you can commit to Semana in the future and say, I want to take this to a certain level. I want to sit with George and Ayman and others and think, how can I, after graduation, and I think there will be a workshop like that, how can we serve more? How can we serve differently? Because you are our future also in this organization. We are not doing it just to have a retreat. That's not only the point. It's great to have you. But what are we going to do with you? And without you, we cannot. That's what we are hoping to learn. Do not quit easily the service. A lot of you are servants today. And I'm not sure why people, when graduate from residency, they stop serving. You should serve more within work and outside work. Because, again, it's a responsibility. Stay to participate even if you are not the leading person. Sometimes we are so proud because of our prestige, our honor at work, and I'm this at work. And when Andrew doesn't take my opinion or he doesn't follow my direction, I say, I'm not going to do this. I'm not coming to the service. I'm not, because I became the doctor so-and-so. Stay humble. Stay faithful to your humility. Because that's how you were blessed. So, this is what I try to cover, and I'm hoping this is a good basis for Abuna to cover in the coming 2 lectures. But please, if I want to leave you with one thought to think about when you are alone, think what you are not faithful in, seriously, and what you need to be faithful in all these points. And I want you to think that another person could have easily taken your position in life and have done much better than you. So what are you supposed to do to deserve the blessing that you are in? Glory be to God forever. Amen.
Thank you so much, Dr. Haney. We have some time for questions.
Sure.
If you guys want to take a second maybe to process that, but this is a really great opportunity if you want to ask any questions.
Any questions?
Yes.
I saw in one of the, we went through kind of quickly, but in the figure before, the one that I was looking at, whether they want to hear about God versus where they are in their care, the one before it was, I thought I saw the reference was for Journal of Oncology. So
No, it wasn't Journal of Oncology. I think one of them was, I can give you all the slides, but unfortunately none of them from oncology. However, I have collected a lot of articles, whoever is interested in medicine and spirituality. I find oncology, I'm biased now, I find oncology needs to be one of the most spiritual doctors for obvious reasons. However, though, unfortunately, most of the journals I have read or articles I have read are coming from family practice, American Society of Psychologists, chaplains, things like that. But I don't think there was one from oncology. But is that your question, or you have?
Well, to lead on to that question was,
yeah.
It looked like the numbers were very high in terms of the desire to speak of. I forgot what the question was, but something was like whether to speak about God in the environment. Do you feel like, huh?
When they were dying.
Oh, when they were, exactly.
Yeah. So
is that, and of course, like in a more like I guess in a more routine. I know you kind of covered it, but in a more routine specialty where there is not the idea of death, is it? I mean, some patients feel uncomfortable. Like I've had experiences where patients feel uncomfortable even opening up, or they'll run by it very quickly, they won't like want to
So
get into it.
the University of, I think Georgetown, have published something called HOPE. It's a different lecture. I'm not going to take time, but each this is an acronym for how to take a spiritual history, HOPE. I have to put the slides for me to remember, but even if I read you something from David Levy, how he did ask, I hope I find the paper. But basically the first question, not to load you with the information, the first question is, what's your background? Sir, what's your religious background? So he can say, I'm atheist, or I used to be Catholic. That's a very common answer, by the way. But then the second question is, do you mind if I discuss with you your spiritual background? And the third question could be, do you have a problem if I can pray with you? Usually I don't take that in an office visit. You have not dealt any report yet. But if you're doing a procedure, you're talking to a patient after many visits, and regardless of cancer or not, I think a lot of patients are willing to do that. The problem, we are scared, or at least we are not sure what is the outcome will be. By the way, the outcome could say, no, I would rather not pray. I said, fine, no problem, respect very much. What I would say, he would say, oh, I don't believe in God. And sometimes if you are very close to him, did you used to pray? Did you used to believe and now you don't? And the answer usually yes. And if you have the time, you can ask more, but at least you throw a seed. But if you are interested, I have a whole, as I said, I'm very interested. I told George we are trying to put something together as a curriculum, how to evangelize to our patients. So I read a couple of things, and I have many articles read and unread, but that's the gist of it. Yes?
So like you said, you pray with your patients, right? How does the prayer go like when they're not Christian? Like do you change the prayer, or how do you communicate?
If I'm not Christians?
Yeah, who are not Christian.
No, if they are not Christian, I usually, if I meet a Muslim or a Jew, I tell them, listen, you have a lung cancer, you have a stage 4, I would like you to go to your spiritual leader or go to a rabbi and have peace with God. That I basically say, and leave it this way. I'm not ready yet, at least personally, and that's a weakness, to actually evangelize Christ to the non-Christians. However, if you find an atheist patient and you have built a report, it's easier for me to talk to an atheist about God than a guy, especially that you don't know how his family will react to that. Okay? So, no, I don't pray with non-Christians. So either, regardless of the denomination, you can pray with any Christian. And you don't have to stand up and look to the east and things like that. You can sit down.
Don't be weird.
Dr. Ivy.
Actually, in that situation, what I do is I will tell them, I'm going to pray for you.
Yes, very
That
true.
I'm not saying I'll pray with you, but I will pray for you.
Yeah.
A lot of times the patients will appreciate very much when the doctor or the caregiver cares enough to remember them in their prayers.
Yes.
And if I see them on their next visit, because a lot of mine is office, I tell them, I have been praying for you, how have you been doing? And that, just those words, are like so comforting to the patient.
Yeah.
You know, that you care enough.
Yeah, very true. So whoever didn't hear the comment, because it's excellent comment, is you don't have to pray with them, but you can tell them, I'll pray for you. Dr. Hain.
I have a question, but just not to show off, but
بس ممكن ما تسألش السؤال بتاع بري مودرن ومودرن من المرة اللي فاتت وأنا خايف يعني.
Just a small story before my question. So I was doing my rounds in the hospital, and I found a wife of one of my patients. She told me that my patient was in the infusion room. He has cancer, so he's receiving, but he's my patient. So
Just in case if you don't know, Dr. Hani Aryan is a nephrologist.
Yeah. So he, yeah. So I said, okay. I'm coming back. I thought that the visit would be high bar. So I went to the infusion room, and I found two of my patients. The female one, one female and the other a woman and a man. So the female hugged me, and I stayed with her for at least 15 minutes, talk about things. And the other guy started to cry, so I spent at least half an hour. So I said,
You are very effective.
So don't go to the infusion room.
And this is not to paint a black picture of our work. What do you do if you put your soul and heart in caring for a patient, and later on you get a lawsuit from that patient? How you feel and what you do?
Okay, so whoever didn't hear the question, if you have given your everything to the patient, you cared, you loved, you did everything, but they turned around and they sue you. And I think that's an excellent question. Our specialty, as much as it's very rewarding in many things, some patients, when they are angry, and usually angry at themselves, they project the anger upon the doctor, especially if he has done everything right. If he really messes up, that's something else. He deserves it. But if he didn't do anything wrong, some of them pick on anything, and unfortunately, lawyers instigate that in them, and eventually they sue. I can tell you some of the best doctors were sued. Some of the most responsible, faithful doctors were sued. That doesn't mean at all that he or she are really bad. What do you do about it? In my opinion, of course, you want to pray that the lawsuit get dropped. But the second is, you can't do anything. I think the question is, of course, the anger that comes to build in you, that you are so angry at this person, you have done everything, and he or she turned around to hurt you. The only thing, it happened to me twice, and thankfully both of them were declined, both cases were declined. But the only thing I felt, that for the first time, I thought, what is injustice for Christ on the cross means. And I think that's not a bad lesson to go through. Like, when we see Christ and he was the sinless, and he was called every single sin in the book, and he was unfairly treated by all stretch of thoughts. So if that happens to you and you are sinless, bless you, you are at this point being considered in the best group of people, and in front of everybody is Christ. I have a question here. How can we prepare ourselves to handle personal, spiritual, psychological, personal, psychological issues with our patients? There is some more comment. We prepare ourselves for years to treat people medically, but expected to treat psychological, spiritual, and personal matters of our. How can we be ready to do that? This seems special gifts that God grants. Okay. This is my opinion, and again, I would love to hear other opinions. Medical schools today do not teach so much how to deal with the other holistic things with the patient. Some medical schools started, by the way. Like for example, again, searching the spirituality, Georgetown out of I think there is only 14 medical schools out of all the medical schools in the country are teaching today a spirituality curriculum from 4 lectures. Some give 1 lecture here and there, but Georgetown is probably the leader, and some of the authors that I brought are mostly from them, like King and others. Now, in my opinion, we are more prepared by your upbringing in a Christian environment and being a devoted Christian to be the best Christian doctor to deal with paramedical issues. We go and visit poor. We go and take care of children who cry in a Sunday school. We sometimes sympathize with a woman who lost her husband. This is the best field that you guys were trained in. The problem, we are scared to practice. We have it. Each single one of you, I'm sure, has it. Has the kindness, has the sympathy, has the ability to be kind. But the problem, we are afraid to show it. You know, I was reading an article in Medicine, in oncology, by the way, and they say one of the best things a doctor should do should actually put his hand on the shoulder of a patient and tap. We are doing this right and left. I mean, can you imagine? This is to them is like a big leap of help. And there is a whole article written about يعني واحد يطبطب على واحد. I mean, I was really reading it, but believe me, it's written. It's written literally in the literature of medicine. And they tell you, you build a bond and there is a physical touch. Fine. We have much more than this. So thank you for the question, because it tells me that you are afraid of what you cannot do. But I want to assure you, you have it. Every single one who have brought up in a Christian attitude, you have it. I mean, it's in us. What is left is to actually train ourselves to show it. Yes, Habib.
So I kind of want to encourage, what I've noticed in myself at least, because I'm a second year in medical school. First and second year, you go into any field, and you really don't know what you're doing. You don't know the science, you don't know whatever the intricacies and whatnot. You're kind of just being bombarded by information. And here, every once in a while, you get to see a patient. And when you get to see the patient, you don't have the knowledge of medicine, for instance, to actually do anything. So you spend this time with the patient, and really there's nothing else for you to do. Like, I find myself then just talking to them, and actually then trying to, like, that's a good point for you guys to, like, start getting comfortable talking to the patient about things that aren't medically related. Because you're going to get drowned in that. You're going to have to do that for the rest of your life. So start getting comfortable asking those questions, making those conversations, so that you can carry it with you as you add on the new knowledge and skills that you take for the rest of your education.
Thank you, and I want to sort of echo what you said. I heard from a medical student, will remain unnamed, that actually they met a patient who I believe she was Jehovah's Witness, but she was not quite practicing, and they needed to convince her with blood transfusion, and she was refusing. And out of despair, they told this medical student just to go and talk to her. I mean, everybody like. And you know what? After talking to her for about half hour, she signed the consent. And when they asked him how, he said nothing. I just kept talking to her and laughing with her. And she was very angry at her family, and she wanted to die, so she didn't want to care about blood transfusion. None of them were able to get that history. None of them attending, 2 residents did not. What does this tell you? Being kind, being compassionate, being able to connect, even it's not just the medical knowledge. They say sometimes some of the best scientists are the most sued. You know why? Because they don't know how to be friendly with patients. So patients will never be seen by this doctor, and he is careless and he doesn't have manners and all of this, and everybody's suing him, although he is the top in his field. And maybe another guy who may not have half of his knowledge, but is so kind and so. They teach you this in malpractice when you apply for malpractice insurance. And it's for us, it's biblical. For us, it's normal, biblical, natural knowledge. We learned it since we were young. How Christ would. Yeah.
You know, guys, this kind of comes back to the question we were talking about, okay, what is good? And the reality is that when you go into practice, you're going to face this question every single day of your practice. The problem is that if you conceptually agree with that and you try by your own character to enforce this, I'll tell you, you'll fail. That's where the point of having the source of goodness being Christ. Honestly, when I tell you, and Haiti might would agree with me this is something to be prayed for. This is something to have in your daily prayers, in your fasting. God, give me the source of compassion. Give me the ability to convey you to the patients. Give me the patience. Give me the tolerance. Give me the eyes. You know the psalmist saying, give me your eyes? Okay, that's exactly what it is, because on a busy day, when you're faced with good and bad, when you're faced with money, when you're faced with productivity, when you're faced with $6,000 cash in your pocket that you can make, it's much tougher than what we're talking about here. It goes back to what we talked about. We cannot teach you a yardstick, okay, you got to go in this patient in half an hour. Because one patient might be half an hour, the other patient might be 2 hours. But what we can teach you is like, where's the source? And it takes a lot of spiritual discipline and depth and understanding that God is the source to ask for it in your prayers and in your fasting. It's not that easy.
I've had like conversations with people or listened to what people were saying who were not religious, and one of the things they talk about is like people who use faith alone as a mechanism of healing and how that's not a good idea. And I realize like what we're talking about here is medical-based healing with faith as an inclusion. But my question is, how do we get these people to understand the difference between not using any medicine and just praying and using medicine and including faith and prayer?
Yeah, it's occasionally we see patients who don't want any treatment and they go the whole extreme. That they say that I want God only to take care of me and I'm not doing anything. And the best thing is to, again, what we say always since we were young in Christianity, that God uses medicine to heal. God uses doctors to give wisdom. And I many times tell my patients, believe me, I'm just a tool and God is using. And I believe in that. It's not just I'm saying it. So, of course, that an extreme we can see sometimes. And not just that. I mean, there is also the extreme of no medicine, no God, and just alternative medicine. And unfortunately, this is a growing group of people nowadays, which they call, the alternative medicine group of patients, where they don't want any medicine, they don't want any God, and they depend on many things. Unfortunately, they lose peace as well, not just lose their life. Mike?
I know we're talking about our relationship with our patients, but what have you seen is kind of, we never discuss colleagues, and we never discuss who you work with. Whether it be another physician or another dentist, another person who works with you in the pharmacy, like, is the kind of the protocol the same? Am I acting, do I do anything differently?
Yeah, so the question, just in case if you haven't heard, we have been talking about patients, but is the protocol applies also to co-workers and colleagues, and that maybe doctors, nurses, therapists. I can tell you from reading his book and from my little unexperienced life, is really the most difficult is dealing with your co-workers, doctors. It's very easy to tell a therapist or a nurse, I know you are going through this, I'll pray for you. But it's very hard to tell that, or uncomfortable to tell that to a coworker. So a coworker physician. But in the same time though, faithfulness is a contagious good thing. Like you can transmit faithfulness to other colleagues when you do not gossip about the other doctor, when you are speaking with a lot of purity regarding other doctors, female doctors or female nurses. When you refuse to discuss a matter that's quite wrong to discuss, and you say, I don't believe in that, or I don't like to discuss that, or I don't want to share in the discussion. By you doing this, at the same time, you are an excellent doctor and a good, loyal guy, and you know that they have your back anytime they need you. But in the same time, you are clear in what you don't accept. And that's very important. Thank you for that comment, because a lot of us, in order for us to gain friends, doctors, referrals, whatever it is, we let go of a lot of our principles. And we agree on things that are not Christian or are not agreeing with our dogma. That's wrong. There is nothing wrong to go to a social gathering or a party and attend a Christmas event here and there. That's all this normal. But there are things that you cannot let slip. And that's a very good point, because sometimes we're so good with our patients, but our colleagues are perceiving us are the most unfaithful, or because at least we pose a picture that's supposed not to be ours. Anyone? Yes, Mary.
So I had a question going back to what Nina was saying, how as a med student, we had all the time in the world to talk to patients. It was great. You have like 2 to 3 patients on the service. And then you become an intern and you go from 2 to 3 to 10 patients, and your time isn't yours. You know, you have rounds at like 10:30, and from collecting labs and doing all this cut work as an intern, you'd say, okay, it's 9:30, I have an hour and 10 patients, and in your head you're like, I can't spend more than, 10 minutes max in the room. And a lot, it's like, I'm just gonna go in there, put my stethoscope to their chest, and I'm just gonna tell my attending on rounds about their labs anyway, because it doesn't even matter what they're treating. And the med students actually get to do the, they're following 2 of your patients, they get to sit down, they get to talk with them, and they get to do all of that interaction. Does it get better or worse as an attendant?
Okay.
Is your time yours?
Good, very good question. Again, whoever didn't hear the question, medical students have all the time to talk, all the time to spend, easy to apply what we said. During interns, and I can tell you during the first 2 years of residency is as bad as it can get. Because also as a first-year resident, if you're a surgeon or surgery or OB or any of the surgical, even cardiology, any medicine, you are very busy during even the first 2 years of residency. In my opinion, and again, please have this to be discussed in a workshop maybe, it depends again on what George said, on your attitude towards, if you want to do it, you are praying to God that please give me the chance to practice what I believe, it will happen. Meaning, I know this for a fact, of a resident and used to practice what I'm describing now. He used to live across the street from the hospital. It's on-call residency. So he didn't live far away. He used to come in non-on-call times to spend occasional time with a certain woman or man who needed him the most, and he couldn't do that during the day. I am sure this is a guy in the future will also do that as an attending and as a faculty and as whatever. In other words, it depends on you. It's not a switch on and off. Even if you are an intern, a resident, a busy resident, or a busy cardiologist, or a busy this, if it's in your mind, if it's an attitude, you will bring it. You don't have to spend half hour if you can. Very, very rarely, by the way, patients need that long time. And you can tell them, I don't have the time now, but I really want to sit with you. I need to make that appointment, and I want to spend time. Okay, 1 second. George. Yeah, you first, and then George.
I just, conversely to all of that, as a medical student as well, but I think this applies to every health profession. You deal with patients who are not compliant, and you deal with malingerers, and you deal with people who abuse the system. And I've seen all of these attendings who are very cynical and who lack faith in their patients, who say really terrible things about their patients. How do you, because I feel like there's a tendency, and I'm really afraid this is going to happen to me, but there's a tendency to become really cynical and to say these things about your patients and lose faith in them.
Okay, I want to distinguish between 2 things though. You as a physician need to be trained to actually discriminate between a true patient and a malingerer, because it makes so much difference if you keep surgerizing on a patient every time he comes in, you remove his appendix 4 times. I mean, because every time he comes with pain, so it's very important, and we need, as a trainer, I need to train my residents how to really distinguish a patient, and we have a lot of bone mets and a lot of bone cancer, painful bony cancer. We need to distinguish between a patient who doesn't really need the morphine and its derivatives, and the person who actually needs it, because it's night and day. If I strip a patient from morphine and he actually needs it, because I'm cynical, that's almost a crime. But in the same time, the other one, I need to know that not to give him another prescription. So number one, you need definitely to be trained to find out. Number two, unfortunately, physicians, as I said, sometimes they feel that they're above the system and they can judge everybody and can make fun of everybody. All what I can ask you, please do not join that club. Meaning, a person who is malingering does not make him a rejected criminal or anything. He is, by the way, the people who study psychiatry or psychology know that these people are usually doing this because they need attention. It's not doing this because he likes to come to the ED every other day. They actually don't have anyone home. And you know what? It's the only time he finds a kind nurse who gives him a soup and things like that. And they have to come up with a problem every other day. Absolutely, you have to distinguish. But absolutely, you should not make fun or join the people in demeaning these people.
So to go to the question that you ask about, like the time factor between a student and an intern, and does it get better? So the short answer, it gets better and it gets worse. It gets better in a couple of senses. Number one, when you graduate and become an attendant, you, for the most part, have control over your day, and you can, to some extent, control how you address and the time you address the patients. That's number one. Number two, when you are an attending, technically you have a better chance to develop that relationship with the patients. Versus an intern, you go from rotation to rotation, you don't have enough time. But when you see a patient over years, that human factor is something to be enjoyed. And it's beautiful when you can enjoy it. That's the good news. The bad news, you come to the realization at that point, once you're done with your residency, that your time equals money. Prior to that, you didn't have that realization. Once you're done, you have that realization. And the power of that realization, that time equals money, is what drives people on the wrong side. Okay, and a lot of us, you'll start your attending job, maybe take about a couple of years to be efficient. The sad thing, as Eugenio was saying, is that a lot of us, when we get efficient, we start to realize, wow, I can make more money, in the same period of time. And you don't think to stop with the criteria that Henny said. It's like, well, I don't need to make this amount of money. I can take this time and spend it with my patient. Because you are getting efficient, and it's a gift from God. But that's when it hits most people, when they start to realize the power of their time that translates to money. And especially when you've got an administrator who is also, benefiting from you being very productive and is giving you all the incentives to sustain that habit. And at the end, after a while, you get to be cynical, you get to not have time for your patients, and you lose that kind of God-given gift. So it gets better, but also gets challenging in some sense, and that's where you need to be fully aware of what you're doing and how your practice is evolving.
Yes. Being like a spiritual doctor, you have to follow all those points, you have to be so faithful, and it seems like it's really emotionally draining, and it can be emotionally tiring. You especially, since you do oncology, you deal with a lot of real serious, depressing stuff, so. I'm sure there's nice parts of it too, but so how do you, is there a certain point where you feel like, okay, I'm invested too much to the point where I may be hurting myself, and then at that point you're hurting yourself and you're not really that great for your patients, so is there something that you need, or some thought you have, you're okay, I'm getting too involved, I need to take time for myself, or how do you protect yourself from being burned out or just being too emotionally drained?
Excellent question again. But by the way, although oncology is very evident and very clear, but every single specialty, a cardiologist who gets so attached to a 35 years old who needed a cardiac transplant and she's not getting it and she's going to die, because of rejection fraction of 10%, and he knows it's the same like oncologist, it's the same like an infectious disease guy who has a very virulent infection and septicemia is making him a cardiogenic shock and nothing is happening. Similar to a surgeon who in front of him major bleed and he can't control it and he knows the family has been treating this guy for years. All of us can get hooked or attached. And that's why it's very important, as much as I'm asking you young doctors to become kind and passionate and faithful, I want you also to be faithful in God. Because what actually protects us is really going home and praying and leaning and leaving all this burden that you have seen and all the hardships and afflictions and the cries and whatever happened and the young girl who had radiation to the brain and beautiful hair lost and her mother is crying like crazy and it's very hard. So number one, you